Hi there everybody, Dr. Suneel Dhand, internal medicine physician with Common Sense COVID Doctor. Healthcare facilities have done an absolutely terrible job this winter at preparing for the COVID pandemic second wave. Now we know how pandemics work. If you look scientifically, pandemics typically follow a very similar pattern. We were inevitably going to get a second wave during the winter, and a lot of viruses spread during the winter. Most do when people are exclusively indoors. This was not a surprise. Why have healthcare facilities therefore been taken off guard? I work in the United States. This has happened all over the country. I know in the United Kingdom, the National Health Service is under extreme pressure. And if you go back and you look over the last few years, healthcare systems are always under extreme pressure over the winter. Literally, the NHS, I know I read the BBC website, is always facing crises every single winter. Go back and look at those articles. Therefore, add in a pandemic, and this is not really a surprise that we're in this situation. It's like knowing that you have a big game coming up and not preparing or training at all and facing an opponent who is inevitably going to whip your butt because you're unprepared. And it's also like being in a war. In many ways, this is a war. You're there in the trenches. You know your enemy has gone back, is about to regroup and charge back at you. You don't just sit there and not regroup and reinforce yourself. It's absolutely ridiculous that we're in this circumstance, and I hope we can learn some future lessons. What we should have done is 3 things. Number 1, hospitals should be prepared with regards to beds for the inevitable surges that happen over the winter. Why is it a surprise when more patients get sick during the colder months? We should be ready and have that excess capacity there ready to cope. Number 2 is adequate staffing. This is a big one. Doctors and nurses especially, healthcare facilities should be prepared for having extra staff come in so that the staff that are there are not overstretched. We see these stories all the time as well. Hospitals everywhere do not have the staff to cope. Why has this happened? We knew this was coming for months. And number 3 is having a dedicated contingency plan in place. Healthcare facilities everywhere should have these plans which they can quickly roll out. All the staff know that this is the contingency plan as soon as winter hits and we face a surge of patients. This time it's COVID, but it could be any winter where this rule should apply. We have done a very bad job for years at preparing for winter. And now with a pandemic, lo and behold, we're in this crisis. We have to be doing a better job in the future.